then it's most probably any other person from Ministry of Health, not forgetting the minister herself. But the president yesterday came out and he was very categorically clear on sharing with us the statistics to date. But you can't take it for granted. Emmanuel, let's start right now. How is the stand and the situation when it comes to the statistics of Ebola in Uganda?
The statistics have not changed very much. We still have 54 confirmed cases. We have lost about 19 people due to Ebola, and about 20 have recovered from Ebola, which gives us hope that much as this is a very deadly disease, there are people who can be able to fight and come out alive and recovered.
Okay. Now, was it this week still? Was it on Tuesday, I think? 4 cases were dismissed. Of 4 people who recovered were sent back home. Tell us a little bit about it, because of course it's quite exciting to see that you have cases of people who can recover.
We had an event at the Entebbe isolation facility. We have an isolation facility for epidemics in Entebbe, and the Minister of Health and the top technical people were present. We were able to discharge 5 health workers of the 7 who were infected while they were operating on a patient in the Mubende Regional Referral Hospital. So it was a very exciting moment to see our health workers recover after fighting Ebola. And these first received treatment at Mubende. They were later sent to Fort Portal Regional Referral Hospital for specific management. But now we have taken a decision that all health workers who contract the disease, unfortunately, will be managed at the Entebbe isolation facility. We have another isolation facility at Murago, which is newly constructed. We shall also be isolating there people who are contacts to confirmed cases.
Okay. Now, like in Mubende, where were they? Were they in the general hospital? I'm saying, like, if the cases that, like the first case that was there, and was he isolated? Do they have a specific isolation unit as well there, or are you planning to create one, given that's where the first case was discovered?
We have already created what they call an Ebola treatment unit at Madudu Health Center 3, where the first case received treatment. Because the first case started in private clinic and later on sought treatment at Madudu Health Center 3. And we have since established a mini Ebola treatment unit at the center, given that the epicenter is in that Madudu sub-county. But it has since spread to a number of even divisions within the municipality, Mubende municipality. But Mubende remains largely the epicenter. We have also had cases in Kasanda, Kagadi, Chegegwa, and Bunyangabo. So the epidemic is still limited to those 5 districts.
Okay.
Yes.
Now, given, let me use the Grade B hospital in Entebbe, the hospital there, because around the time when we had COVID, and people just got to know that the first case was there, they abandoned the hospital. So it practically remained like specifically for that. Is this the case right now with Ebola, or
no, because
still other services
within Mubende Regional Referral Hospital, an Ebola treatment unit has been established. These are tents. These are tents that have been put together thanks to MSF, which are one of our key partners, who has been key in putting up these Ebola treatment units, because now we do not treat these patients within the buildings of the hospital. So there is continuity of all the other services. The Ebola patients are handled in the Ebola treatment unit, and we have expanded this treatment unit. And also the Ministry of Works has given its grounds. We are setting up a bigger Ebola treatment unit in case the numbers increase. And also that's why we have had in Entebbe now is operational, the isolation facility. It's been there for some time, and also a newly constructed Mulago Hospital Isolation Unit has also now opened to be an isolation facility for key contacts. We are following up mostly for 21 days. For instance, there is a case of a wife to the man who died at Chirudu, that delivered the baby at Katabi Health Center 4. We have since isolated the health workers who delivered the baby, and now they are at the Mulago Isolation Unit, as the patient is now at Entebbe Isolation Unit receiving treatment.
Okay. Now, talking about the case management, I'm just curious, or I'm sure even the viewer would feel the same way. Would like to know, how has this been done for you to be able to get the success stories that you've had of recovery? How is case management done?
The good thing is that given our previous experience as a country of handling previous Ebola outbreaks in 2000 and 2012, we had Guru, we had Bundibujo, we had Chivale, we had Ruwero, then also the Marburg, because it's also a viral hemorrhagic fever. We have built capacity and also been able to train, having health workers who even went an extra mile to support countries that had an outbreak in West Africa. So we have since recalled some of these health workers who have experience previously handling Ebola patients, and they are part of the team that has been able to help us in case management, because the people know what they do. They've handled this kind of disease, a viral disease before. Yes.
What's the incubation period for this kind of disease?
This outbreak specifically is the Sudan, Ebola Sudan type, Sudan virus, the strain, and we are able to isolate these patients. We know the type, the treatment is supportive, but we were also able to receive some trial drugs, therapeutic drugs from the American government, like monoclonal antibodies, and also remdesivir, a drug which is on trial. And we have seen, for instance, among these health workers who were treated using those kind of drugs, the improvement was a bit fast.
Now, there are situations or scenarios where I would say, like, it was very easy for us to get cautious in case somebody had a cold and a flu, and you're able to tell that maybe this is COVID. But now here, for some of the symptoms that you talk about for Ebola are pretty much more like symptoms for any other malaria, typhoid, some of the characteristics. So many people are like, I think by the time they confirm that it's Ebola, one should be passing blood from, you know, the external organs. So how are you going to help people to identify? Maybe that's how the health workers will go and contact somebody or treat a person without knowing that actually that's what they're dealing with.
Of course, like the earlier, before the confirmation, our health workers, we are taking them as either malaria cases or normal other infections. But after the confirmation, of course, the case definition has been issued. All the health workers are on high alert to be able to quickly identify, because now they have to increase their level of suspicion. If you present with symptoms like diarrhea, fever, vomiting, general body weakness, then they must be able to rule out Ebola, given that we have an active outbreak. Yes.
Then, besides the isolation, besides the centers that you have, is home confinement one of the options you're considering in the response and managing of Ebola?
We don't recommend it as of now, because we are able to isolate all the patients that are confirmed. For better management, you have to be admitted within an Ebola treatment unit. And being a contact, the disease that is spread through contact and body fluids, it's better you are isolated in a designated Ministry of Health facility for better treatment. And we appeal to the population to report early, because if you have symptoms and delay, the outcome might not be as when you report when the symptoms start showing, such that we are able to test you. If you're confirmed positive, you are able to receive supportive treatment.
Okay. Now, what's the ministry's plan in terms of scaling up a response? What other measures do you have prepared at the fingertips?
Of course, we have our risk criteria. We have mapped out the country. We have high risk, we have medium risk, and low risk districts, and we keep, based on the epidemiological data, we keep monitoring this risk depending where we have confirmed cases. For instance, now it is highly limited to the 5 districts, Mubende being the epicenter, so that is where now there is high risk. But even Kampala being a commercial hub, a point where many people come, it's among Kampala Wakiso are among the high risk parts of the country. So we are able to rank them, and we have intensified risk communication and community engagement across the country. I've entered here when UBC was praying messages on the signs and symptoms, and these are being aired out across the country. We have also teams, the members of the rapid response teams under the various pillar: case management, risk communication, surveillance, contact tracing, are all on the ground. And we are also having community dialogues, working with the local leaders as a way of sensitizing the population, because cultural beliefs, for instance, like witchcraft, has been pronounced in this current outbreak, because many people have been trying to run to traditional healers before they report, which is also one of the predisposing factors that can trigger this virus to spread.
Okay, you talked about contact tracing.
Yes.
And it seems like it's one of the major, method that's used a lot during trying to control and in terms of response of these epidemics. How easy has it been for you to do the contact tracing for the 54 cases confirmed?
I can't say it's been easy because the teams have been citing a number of challenges, like resistance from some families. Some families are cooperative, but some have been resistant. But the teams are on the ground, and some have, even there's a specific family that at first was highly resistant, and they lost some members, but I've been following the teams on the ground, and they are giving feedback that the family has now cooperated, and they are all under isolation in a known facility where our contact tracers, people who do psychosocial support, are able to talk to them and monitor them. I think you asked about incubation period. The incubation period is about 2 to 21 days. That's why if you are a contact to a confirmed case, we need to follow you up every day as I take your temperature for a period of 21 days to rule out you developing symptoms. Yes.
Okay, that's interesting. Now, in terms of the community engagement that you said, are the VHTs, have they been sensitized about this? Because remember, they are more out there into the communities, and they would reach practically every household and would possibly be very supportive when it comes to contact tracing.
Yes, we are undertaking training and reorientation of the village health teams, because they are largely our foot soldiers in the villages and the parishes. They will be able to know who has the symptoms, who has not been able to work, who has been bedridden. So we have engaged them. The trainings are ongoing, and they are going to be even more intense in the coming days. We have also from Monday up to Wednesday, we had refresher training for all district communication officers from the high-risk districts and the district's health educators. This was held in Mitiana by our health promotion department, and the training was supported by Africa CDC. So we are able to ensure that everyone is at the same footing to enable us to respond better. And it's largely risk communication and community engagement that will help us defeat this current outbreak of Ebola.
Okay. Then for the purpose and the benefit of a person watching, because you know, like, I'm forgetting the short definition that was used during COVID that they would tell us, that would clearly say ears, nose, and mouth in terms of how we were, ears, no, actually ears, nose, and eyes, of how it was spreading. Now, for the lay person, how is it spread? We talk about the body fluids, we talk about, one might think, if I shake hands with you and besides you're not sweating, how will I get it? Please, for the benefit of it, I beg for you to share with the person.
Because if you touch sweat and you pick a virus and you later touch your eyes, your mouth, your nose, you're likely to contract. So it is a
body contact.
A body contact infection. And it's also, this is facilitated by the body fluids, tears, blood, feces, urine. All these can enable its spread once now you get into contact with a contaminated clothes, for instance. That's why we destroy all the people who have recovered. They are given a new kit, a recovery kit, a mattress, bed sheets, utensils, phones. The past patients we discharged in November, one called Alex was asking, what happens to my phones? So they told him he will be given new phone, because we do not know whether your phones are safe. But we are doing a study to know whether these items, the virus can survive on these items. So that would guide on how in the future we can handle, for instance, such items. Because an item like a laptop, people have valuable information, so we need to know whether these can be disinfected such that someone is able to use them and know that they are safe.
Oh yeah,
yes.
True. Okay, at this particular moment, I would like us to go for a very short commercial break, and then when we do return, we shall continue with this topic of discussion on Ebola response, what the Ministry of Health is up to. Wow.
That there are confirmed cases of Ebola in Uganda. We, however, urge the public not to panic as the situation is being managed. The Ministry of Health further reminds the public to be on the lookout for any persons who may show signs and symptoms of Ebola. These include high body temperature, abdominal pains, diarrhea, vomiting, bleeding from the body openings such as the nose, eyes, and mouth. Please inform the nearest health worker immediately if you see anyone with these signs and symptoms. To prevent Ebola from spreading further, please take the following preventive measures: regular washing of hands with water and soap, avoid handshaking and hugging, avoiding any contact with any suspected Ebola patients. Any person who dies suddenly should not be buried but reported to the nearest health worker or LC1 immediately. For further information, please call the Ministry of Health toll-free number on 0800 100 066 or send a free SMS to your report on 8500. This message is from the Ministry of Health with support from UNICEF and World Health Organization.
As we celebrate this year's World Food Day, the Ministry of Agriculture, Animal Industry and Fisheries, in partnership with Food and Agriculture Organization, World Food Programme, civil society, MDs and other development partners collectively call for strong action across the sector players to ensure that our agri-food systems deliver enough, affordable, nutritious and safe food for all in a better environment for a better life. This year's World Food Day will be celebrated under the theme, Leave No One Behind, Better Production, Better Nutrition, a Better Environment and a Better Life. The event will take place at the National Crop Resources Research Institute in Namlonge on Sunday, October 16th, 2022.
Welcome back from that commercial break. You're still watching a health show, proudly sponsored by National Medical Stores. And like I told you earlier, the topic of discussion is Ebola response with none other than Emmanuel Ainebiona, the Senior Public Relations Officer from Ministry of Health. Emmanuel, let's continue back to our topic of discussion. We're still getting deeper into the issue of case management. But before we get to that still, I'd like to find out how is diagnosis done differently? Because everybody knows it quite well for COVID, the swab, you know, either in the throat or in the nose. How is this one for Ebola done, out of curiosity? Like
They pick a blood sample. Yes.
They pick just a blood sample.
Yes.
Okay, then that is good. Now, in terms of, you were still telling
or
us,
any of the body fluids,
and
they can still detect it.
even if they did a swab,
Not the swab,
not a
because
swab.
now this is you can trace it in the blood.
it's easily traceable in the blood.
Yes.
Okay. Now, when you were still, you talked about case management with some of the drugs, and there's a word and a phrase you're using quite a lot, or even when we're reading about some of these outbreaks, and you call it supportive treatment or
Yes.
supportive care, because it's treatment for us. When you talk about treatment, I know it's about maybe giving the IVs, giving this, the other, supportive.
Yes, because there is no approved drug that can, like way we take antimalarials and you're cured of malaria. But this, there is no specific treatment. But as I said, there are already those trial therapeutic drugs like remdesivir and also the monoclonal antibodies, which are being used to see whether they can treat Ebola virus disease. So that's why we refer to it as supportive treatment.
Okay.
Yes.
Now, how will you do the, do you intend to monitor those that have recovered to see, because certain times, what are the chances, like we had the first cases of COVID, that they will not be, community is not going to stigmatize them and look at them as such, like, you will infect me. It's the bit of people believing that actually somebody has recovered.
Yes, we sensitize the population, the communities, and we have a pillar called the psychosocial team or psychosocial pillar. These ones are supposed to counsel the communities of an affected person and also counsel the person who is being discharged after recovery, because the number of patients who have recovered are worried about how they will be received in the communities. But would like to tell those ones watching us right now that you can recover. I am a former COVID-19 patient, but I'm here. Then when I had just tested positive, no one wanted to reach near me. So it's the same. I recovered from COVID-19, I'm here. The same applies to someone who has received treatment. When they take a retest as tested negative, that means the virus is no longer in them or in their bodies. So, but this message is supposed to be told by people who have experience and are able to counsel the survivor and also their families, because everyone comes from a family. There's a medical student who was saying that my dad is worried, so ensure that you come with me.
Oh dear.
Such that they are able to receive me back. Because for him, he thought maybe the father might think he has run away from isolation. But at the discharge, you're given a certificate, or a discharge certificate, which was also given. I have mine for COVID, which shows that you have recovered. And you're able to. So anyone who has been receiving treatment should be able to present a recovery certificate. So if someone has a recovery certificate, that is which is valid, because Ugandans know how to forge. You must have a valid certificate which is proof. But even our teams, the psychosocial teams, before you're discharged, they are supposed to go to your community, talk to the community members and the family members. But also, we ensure that we follow up our recovered patients to see how they are improving.
Okay.
Yes.
Then is it true that the virus can persist in somebody's body fluids even after recovery? Say like, they say breast milk and semen.
Yes, there are previous studies that have showed, mainly in semen. That's why one of the key messages the Minister of Health has been giving to the young men being discharged is ensure that they protect their loved ones by either abstaining from sex for a period of about 1 year or using a condom.
Oh, wow.
Because the virus tends to stay longer, much as in the rest of the body, it is showing that you're negative, it might stay longer in semen. So as a measure of protecting your loved ones, you have to ensure that once you indulge in sexual intercourse, you use a condom properly.
Okay.
Yes.
Then what about in breast milk? Because why I'm concerned to ask about the breast milk is the case of this mother, you know, who is tested, who is a confirmed case, and has just given birth.
Of course,
she has the baby with her at the center, I assume.
There are other, for now, since she's active case, still receiving treatment, the baby will have to be supported through the bottle and other supplements until when the mother is able to they are able to do tests and rule out the virus in the body fluids, including breast milk.
Okay.
Yes.
Then, just for purposes of asking, still out of curiosity, like those who handled her, I would assume that naturally, if they suspect, the first thing for the medical personnel is to ensure they use gloves for protection.
Yes. This specific one was already on our watch list, so all the health workers were protected, and we expect to monitor them for that 21 days to rule out that no one develops any signs and symptoms.
Okay.
Yes.
Among your confirmed cases and your statistics, the 54, do the sex vary? Is it the men that are more?
I think that I'm going to check the latest report and be able to give that detail at a later point in our conversation.
Okay.
Yes.
But it still hasn't yet fully been confirmed yet.
No, we have let me check quickly.
Okay.
The situation report.
Because it's so far only one mother was given birth, the rest?
Yes. Yeah.
And how are you dealing with the issue as you're checking the report of, you said most people, all the cases you've gotten in this scenario, believe their first bit is they deny you and then thinking it's witchcraft. How are you planning to manage and to deal with that? Because have you also gotten, like, say, the witch doctor of where this person had run to in Luero? Just out of curiosity, I'm asking.
Yeah, what I can say is that Our risk communication and community engagement team is also ensuring that we have engagement with the traditional healers,
Yeah.
the witch doctors, and also the people who transport these patients, the border people. We are engaging them to tell them why it is important during this outbreak to refer patients who present with symptoms that are consistent with Ebola to the nearest health facilities for better medical attention before they start performing any other rituals. Because even them, they can be victims. Yes.
Okay.
So I've just seen the summaries of the
confirmed cases.
Oh, this one doesn't show.
Okay.
It doesn't show the
genders. Okay,
Yes.
it's okay. So as we get further still into it, there is one of the management, or in terms of the response, one of the managements that you're doing, that is the dignified burial. Please elaborate more about it, of the people that have passed on.
One of the other
Interventions?
risk factors
okay.
is when someone dies of an unknown illness. And you know, because we have a lot of cultural beliefs, preparing the body, some people would want their loved ones, they need to apply makeup, washing the body, and that is one way
Of
how
contact,
you can get into contact with an infected body. So we have discouraged handling of bodies within communities. If someone has died and has been presenting symptoms consistent with Ebola, or you do not know what has claimed the life of that loved one, that's why we need our teams to be called in that conduct safe, dignified burials to ensure that there is no transmission at the burial. The case of the index case, most people contracted from participating in a burial. And that's how the disease, people who had come from as far as Chegegwa, as far as from Kasanda, were linked to, because they participated in a burial of someone who had died and had Ebola.
Okay.
Yes.
Now, do we have a vaccine? Because during the first outbreak of Ebola, the vaccine was there.
Yes.
Do we have a vaccine? And if we have a vaccine, is it the vaccine from the previous strain, or a new vaccine has to be created for this specific strain?
The vaccine that is currently and readily available is for the Ebola Zaire strain. And that we have even given to some people here during the 2019 outbreak in Kasese. We were able to vaccinate some health workers, frontline health workers, and also members of the armed forces like the UPDF who are currently in DRC. However, the current strain, the Sudan strain, does not have a readily approved vaccine, but there are two vaccines, one developed by the Sabin Institute, and also another one, the Oxford and the Serum Institute of India. And we are expecting almost 500 doses, which we shall be using in our trials, because they are still undergoing efficacy. They've already concluded the safety trials, but now, because there has not been an opportunity to conduct the other trial stages, it is important that we shall be receiving some doses to conduct trials on the contacts of confirmed cases.
Okay.
Yes.
And how, with what you're getting, how is it going to be administered? Who will have access to the vaccine?
Largely the contacts to confirmed cases. Yes.
Once you confirm they are negative, but they have been in contact with the confirmed
Yes,
cases.
so we do ring, what they call ring vaccination. But all this is still under research trial. Yes, but this is an opportunity to know whether these vaccines are really effective against the
Ebola.
this Ebola Sudan strain.
Okay. Now, you did talk about the trial. When is the trial going to be conducted and where? Because there are certain trials that can take for forever, and they'll keep on, you know, they'll keep trying based on different categories of people, those who are at high risk and so on. So when is this going to happen?
Yes, our scientists who are the principal investigators are going to they are finalizing with the protocols and approvals, because it has to be approved by the various research bodies. Once these protocols are approved, we shall be coming out as a ministry to give more details on how these trials will be conducted. So I beg that we be patient. When the vaccines are here, we shall have a detailed communication on how these vaccines will be used. But in today's papers, there was the good news that we expect some doses which we'll be able to use in our trials. Yes.
Then talk a little bit about more, because besides the message we have seen in terms of risk reduction to ensure that the risk is reduced, have some of these messages by the Ministry of Health been translated into the different languages to make it simpler for everybody to move along on the same page?
Yeah, from the onset, the messages were translated to the languages spoken in the high-risk districts, but we are now, through our risk communication and PR strategy, having messages translated in all languages that are spoken countrywide. But also we realize that we have some refugees, so we'll need messages in Kiswahili, messages in Kinyarwanda, messages in Lingala, and also messages in French. Yes. Yeah.
Okay, now that's at least good to know that that's being done.
It's being done.
It's being done. And sorry to cross to the other side. Now, I know, of course, we are more concerned about our health issues here. Now, the strain, have you done a little bit as a ministry of research about the strain? Because for how long has it been there, that Sudan strain that we have now got?
Yeah,
how are they managing it on their side? Have we picked a lead from them?
We've had the 3 outbreaks driven by this specific strain. So we've had experience dealing with it. Only that the new thing is that we have candidate vaccines that are at advanced stages. So this will be maybe a game changer when they are finally approved by the World Health Organization. And also yesterday we had an emergency ministerial meeting that attracted more than 9 countries on the African continent, mainly neighbors to Uganda, and also some countries in West Africa that have an experience dealing with Ebola. And there were discussions on how best we can work together to prevent any future outbreaks. So this was yesterday at Speak Resort Munyonyo. And there were a number of ministers of health representing their countries.
Okay. Still going back to the confirmed cases, at least so far we don't have any youth or children actually.
No, they are also young children, and that's why...
oh, that's why you were still... Okay.
That's
now,
why
among
I
the children,
need to...
maybe just to share, as you get me the story of the children, have the children contracted it from their family or parents? Let's say they are not children who are in boarding school and they are moving in and out of home to school, and as a family, if the whole family gets it, that's how they've also gotten it?
We have given SOPs to schools. Children who have symptoms have to keep home, or those ones who are from the families with confirmed cases, and they have to first be followed up for a period of 21 days. We hope that this current outbreak would not disrupt learning, because we are going in a very critical time. So the schools have to be highly vigilant, have to ensure that all the provided SOPs are implemented to the latter. We are moving into primary leaving examination, universal, the Uganda Certificate of Education and Uganda Advanced Certificate of Education. So we would wish to have a seamless end of their final term.
True, it's good
Yes.
to wish for it that way, but what happens to, like, when it comes to, this is a common practice when we go for visitations. Of course, as parents, there is this hugging, this excitement, touching the children.
All those have been detailed in the standard operating procedures for schools, and I think there is a limited interaction to avoid physical contact, but also we have ensured, we have asked schools to put hand washing facilities such that there is regular hand washing and also proper sanitation within the school environment. And we pray and hope that there is no case imported into a school.
Gladly you talked about something like hand washing.
Yes.
Now tell us, when we wash, the virus does not stay on our hands?
When you're using, for instance, Jik, and also these sanitizers we had during COVID, they are effective in killing the virus. So that's why it is highly recommended. But for the health workers, they need to ensure that at all times they have their gloves and also a face mask, and to some extent an apron if the patient you're really handling already is exhibiting the signs and symptoms.
Why isn't it passed as an SOP, as a mandatory, as and when they're dealing with any patient for
yes,
now?
It's been issued among the infection prevention control guidelines to ensure that we do not have more of our precious health workforce contracting the Ebola virus.
Now, we have so many private clinics, that much you will agree with me.
Yes.
How are you working hand in hand with them to ensure that they also are speaking the same language as you, and they also come up to,
The
be able to
Director General
respond the
has
same
already
way?
communicated to the entire health system on the case definition, on how these patients that are presenting signs need to be isolated, and to ensure that samples are quickly obtained and dispatched for testing. Yes, either at the Uganda Virus Research Institute or through our Central Public Health Laboratories in Butabika.
Okay.
Yes.
Okay, because my worry is, like, I imagine some of these small clinics might not have a laboratory, and they're treating people possibly clinically. They might, even if they have a laboratory, some of them might have, they might not have the necessary reagents to be able to help detect
Of course,
the virus.
they cannot be able, there is no clinic that can test
Have the
for,
kind of Ebola.
yes, to test for Ebola at the moment. The same it was for COVID. Because later on capacity was built, we had to accredit private laboratories to conduct testing. But for Ebola now, it's largely done. Only what health the facilities need to do. Someone presents with symptoms, obtain a sample, or refer them to the facility where they can be best managed. And I said within Mubende Regional Referral Hospital has an Ebola treatment unit. Madudu has a treatment unit. At Fort Portal, we have JMedic, where we are managing the health workers. But all regional referral hospitals have the capacity to treat any patient who presents with Ebola symptoms. But mainly here in Kampala, we have an isolation facility at Mulago, which is now ready, and also the Entebbe isolation facility, which isolates highly infectious patients on behalf of Entebbe Regional Referral Hospital.
Okay.
Yes.
Then how are you supporting the medical team? Because they're at the front line of it. I would say it's like it's their job, it's their calling. They have to save lives, but at the same time their lives are at risk. How are you trying to encourage them? Because some of them might even feel a bit demotivated, and the fear. Because why I'm saying that is I have seen it in scenarios of where people have gone and have studied palliative care, but they don't want to practice it because of what they see, you know? They don't have that hope. So what is it like for the medical team out there?
I would like to begin by appreciating our health workers countrywide, because in a moment like this, when we are having a battle against a viral infection, they come out to protect us. So I would like to thank them for the good work they are doing, and also encourage them to save lives, because that is one of the callings for the natural calling for our health workers. But also as a ministry, we are cognizant that we need to provide them with adequate personal protective equipment, the Ebola kits, the coveralls, the boots, the gloves, all that the ministry is working with its partners to ensure these are provided adequately. Because donning and ensuring that you're careful from an Ebola treatment unit to remove that whole thing, you have to be careful.
Oh, yes.
Otherwise, at that stage of removing, that's when you
yourself.
can infect yourself. So we have to ensure that we support them, but also if you know a health worker who is currently participating, give them a call, thank them, give them a message of encouragement. Sometimes we also have prayers, and we pray with our health workers. At the discharge of patients in Entebbe, we had to ensure that we have a prayer to dedicate them and thank the Lord for their lives.
Oh, yes.
So let's encourage our health worker. If you have a relative, we encourage them. Also, government as a ministry on our part is to ensure that we are able to provide with them with all the requirements, including their risk allowances. And it's our prayer that these funds are made available. Yes. Yeah.
Okay. Emmanuel, I really appreciate your time, and thank you so much for the information that you've been able to share with us tonight. Well, I don't think I need to add anything more. Emmanuel has said it all. Ministry of Health and the government of Uganda is doing whatever it is possible to ensure that everybody is safe. And I would re-echo it and say, so far no confirmed case in Kampala, yeah?
Yes, no
So far,
confirmed
no
case,
confirmed case in
because
Kampala?
the one at Chirudu, all these were contacts to cases in Mubende. So we are counting them on cases in Mubende. We have not had a case surfacing in Kampala to be classified as a confirmed case for Kampala.
Okay.
So no cases, as the President, His Excellency the President stated in his address yesterday, we have no confirmed case in Kampala.
Okay. Now that we know we have no confirmed case in Kampala, that does not mean it is honeymoon. Please, let's follow the SOPs, and let's also be on the lookout. The signs and symptoms is something that we are always constantly running on UBC TV here, and other sister stations and partners are also running out for the same signs. Be on the lookout, be vigilant, but also follow the SOPs. You might need to get back if you have your sanitizer dropped somewhere and you think that after all, now it is safe, it's time for you to use it right now. And also hand washing. We need to get back to the same discipline and SOPs that we used during the period of COVID-19. That was all we had time for. Thank you so much for watching. I'll leave you to keep watching as you wait for the top of the hour, where the 10 o'clock news will be coming your way with Michael Jordan Lukomwa.
The Ministry of Health informs the public that there are confirmed cases of Ebola in Uganda. We, however, urge the public not to panic as the situation is being managed. The Ministry of Health further reminds the public to be on the lookout for any persons who may show signs and symptoms of Ebola. These include high body temperature, abdominal pains, diarrhea,